For Session Update, I'm Shannon Lurkey. A handful of DFL senators and representatives proposed legislation affecting reproductive health care at a press conference earlier today. Here's that event.
Good morning. My name is Andrea Ledger. I'm the Executive Director of NARAL Pro-Choice Minnesota, and I'm here on behalf of the Minnesotans for Trust, Respect, Access campaign. Our campaign believes that all Minnesotans deserve access to reproductive health care, including contraception and abortion, free from intimidation and harassment. It wasn't any surprise to any advocate for reproductive rights when the counselor to the President of the United States said yesterday that there are alternative facts, that that's the world we're living in today. I think women seeking access to contraception and abortion have dealt with a world of alternative facts for a long time now, as politicians have sought to impose their own views in lieu of independent, evidence-based health care. What the facts actually show is that contraception reduces unintended pregnancy, especially when women are able to choose the method that is right for them. The facts show that abortion is one of the safest medical procedures that a woman can undergo. We look forward to a time when women have full autonomy over their own healthcare decision-making based on facts. And with that, I'm going to turn it over to Representative Erin Murphy, who's going to be the author of the Comprehensive Contraceptive Coverage Act.
Good morning. I am Erin Murphy. I'm a state representative from St. Paul. I'm also a registered nurse. I have been carrying legislation dealing with contraception now for a number of years, and there's a reason for that. When I was a second grader and my mom was pregnant with my sister Maggie, the fifth of her children, a woman named Bridget came to live with us. She was from another state, not from Wisconsin, and she was in college and she was pregnant. And it wasn't cool to be pregnant back then and in college and not be married. And so her family sent her to a place where she had no support. She knew none of us, and she lived with us until she had her baby and gave up for adoption. She had her baby shortly after my mom had my sister. And at a very young age, she taught me the real consequences of unintended pregnancies, and that has stuck with me, for all of my life, my work as a nurse and now my work as a legislator. I am happy to carry this year the, say it again, the alliteration, the Comprehensive Contraception Coverage Act, the CCCA, which really rolls into this piece of legislation provisions that we have been working on for a number of years. So one, it assures that people have access to coverage. Any insurance company that covers prescription drugs will then be required to cover all FDA methods of contraception. They will do so without cost sharing for the people who use them, and they will do it with prescriptions for 12 months to make it easier for women to access it. We know, both as providers and now as policymakers, that access to affordable and consistent contraception is the best way to prevent an unintended pregnancy. Contraception is used for many, many reasons. It's used for treating many, many physical conditions. It's used for us when we want to plan when we're going to have our children. There are many purposes for contraception. It should be available. We know that prescription drugs are growing outrageously expensive. We know that insurance companies like to switch out sometimes methods. We want to make sure women have access to affordable contraception, the method of their choice, that one that works best for them, so that they're able to control when they're going to have their families, along with their providers, their spouses. It is a matter of health. It is a matter of economic security. It is a matter of choice and dignity. And we will fight this session and every session to make sure that that is the standard for Minnesota women across the state of Minnesota. Thank you.
Hi, good morning. My name is Riley Carbon. I'm a resident of St. Paul, and I'm here to share my story of reproductive health care. 7 years ago, when I was just out of college, I knew that I needed a change in my birth control method. So I did some research and looked online specifically for what's called a LARC, L-A-R-C, which is a long-acting reversible contraceptive device. On my own research, I was able to see that the Mirena was right for me. The Mirena IUD is one of the most effective forms of birth control on the market. Unfortunately, even though I was still covered under my parents' health care insurance through the ACA, which I was incredibly grateful for, Mirena was still going to cost me about $1,000, and that was not something that I could afford while working as a server in St. Paul. So I went to my doctor to talk about, what were the options that were right for me. When I mentioned that Mirena was going to be my first choice, because again, I knew what was right for my own body and my decision at that time, she told me that Mirena was not something that was given to women who did not have children. And that was not what I had found in my research online, so I felt pretty lost after that. And she had been my general practitioner for years. Through a friend, I heard about Family Tree Clinic. And so I decided to ask them about what would be my options, not being able to afford the LARC that I was looking for. I had an incredibly affirming experience at Family Tree. They not only trusted me that I knew what was right for my own body and my circumstances, but they introduced me to the Minnesota Family Planning Program, through which I was not only able to apply and get approved through very quickly, but I was able to afford that program covered my insertion and the IUD itself. I had no idea about this program before I came to Family Tree Clinic. Because of my experience there and that incredibly affirming experience, that has been my standard of care for future healthcare practitioners of mine. Then 2 years ago, as the Mirena is effective for 5 years, I had to get my birth control coverage removed, the birth control method removed and then replaced. And because of the birth control mandate through the ACA, I was also able to get that completely covered, and I'm so incredibly, incredibly grateful for that. Currently, I am looking for work, and I am so, so grateful that I not only have MNsure healthcare through the ACA and medical assistance. And so under the current climate, we know that we can stand to lose both of these programs, and including state programs like the Minnesota Family Planning Program. I would not be able to afford my preferred choice of birth control without this. And I am incredibly grateful for all of the people that are here today that are going to be fighting to make sure that there's affordable, accessible access to birth control. I will leave you with a quote from Margaret Sanger, who is the founder of Planned Parenthood. "No woman can call herself free who does not own and control her own body." Reproductive and healthcare in general are most basic of freedoms. I am so grateful for all the people fighting for me and people like me, and to trust me to make my own decisions that are right for me. Thank you.
Good job. Good morning. I'm Laurie Halverson. I'm the state representative from Eagan. Very proud to be standing here today. And I am here to introduce a bill that I will be carrying with Senator and Dr. Matt Klein called the Physician Integrity Act. Physicians in Minnesota have integrity, and we want them to be able to practice their integrity with their patients without interference from government. It makes me really sad that Riley has to come up here and talk at the legislature about something so intimate and so personal. This is her business, and the Supreme Court has said repeatedly the Constitution guarantees us a right to privacy. And yet government continues to attempt to interfere in healthcare decisions that women choose to make. And I say women specifically because there are no laws on the books that are interfering in any way with services that men are seeking for healthcare. So this bill would authorize all healthcare providers to provide information to patients that is medically accurate, evidence-based, and appropriate for the patients. It's a little shocking. We have to put that into state law. That's what providers want to do. It's also going to prevent unnecessary interference from government between doctors and patients who are seeking abortion. Currently in state statute, there are laws that state that certain information, much of it medically inaccurate, must be given to a patient seeking an abortion. The patient must then wait 24 hours for their procedure that she is seeking. All of this was passed under the guise of protecting women. But giving medically inaccurate information does not protect patients. So we know what these laws are really about. It's about putting barriers between women and their doctors when they are trying to seek abortion services, making it more difficult to receive an abortion, their constitutionally guaranteed right. But here are the facts. If you want to protect women, women are smart. They know what they're doing when they seek abortions. Most women who seek abortion services have actually already had a child. They understand the process and they understand their bodies. And abortion is one of the safest medical procedures that currently exists. Evidence shows that it is less risky than a tooth extraction. It's less risky than general anesthesia, and no laws exist in Minnesota or elsewhere that require certain statements to be made by physicians to their patients about these procedures. This interferes with the doctor-patient relationship. If the law was about patient safety, we'd have volumes of laws on the books requiring doctors to provide informed consent on all of the drugs that we see advertised every day on the news that might cause cancer, that might cause kidney failure, that might cause liver disease. Check with your doctor, not check with your legislator. Those laws don't exist because they're not needed. Our physicians in Minnesota, our board-certified physicians, practice with integrity, and they practice by putting their patients first. Laws that are created to create barriers to abortion are not needed either. For proponents of this antiquated legislation, there's good news. If people genuinely want to reduce the incidence of abortion, there is evidence-based ways to do that, including providing comprehensive sex education, including providing affordable and accessible contraception to women and their partners. Women, with the help of their doctors, will make the right healthcare decisions for themselves. It's time for physicians to be free from unnecessary government interference, and it's time for lawmakers to get out of the exam rooms. And with that, I would like to introduce my co-author, Senator and Dr. Matt Klein. Thank you.
Good morning. My name is Matt Klein. I'm a newly elected senator from West St. Paul, Mendota Heights, South St. Paul, and Inver Grove Heights. I am also a physician in internal medicine and hospital physician at Hennepin County Medical Center. The legislation I'm authoring with Representative Halverson does not mention any one procedure. It asserts the rights of physicians to provide science-based health care, and in doing so, it seeks to remove politicians from the doctor-patient relationship. It seeks to validate the idea that science matters and we can make good decisions by studying facts. Patients expect their providers to give them medically accurate information based in science and informed by a compassionate understanding of that patient's unique circumstances. If a doctor is required to recite a political platform not based in her own judgment or in the medical evidence, that trust is insulted. Minnesota state law, as Representative Halverson had mentioned, currently requires a woman who is seeking an abortion to sit still and listen to a long set of statements about the procedure, including the assertions that abortion causes breast cancer and infertility. Some of these statements are factually wrong. Some of them are the subject of intense medical dispute. None of them were written by a doctor. All of them were written by politicians who have written this lecture into state law for women to sit down and listen. The people who elected me, a doctor, to the legislature expect me to stand up for patients and for science and for truth. Today is my first step towards satisfying that expectation. Let me share with you that I continue to work night shifts at Hennepin County Medical Center, and every shift I see young women who are in an extremely vulnerable place. Some are homeless, some have suffered abuse, and they come to me after a prolonged period of consideration and self-reflection and fear. There is no chance that I'm going to look those women in the eye and read them a series of false statements or alternative truths that were written by a Republican politician. I'm going to listen to them and hear their story and give them the best medical evidence I can, informed again by their own circumstances. And that's what I'm here to do with Representative Halverson today.
Hello, my name is Dr. Christy Boris. I'm an obstetrician gynecologist, and I'm here today to tell you a couple stories. The first story I'm going to tell you about is a patient of mine, Sarah, who received news she never expected during routine prenatal screening, that her baby had a fatal genetic problem. After multiple appointments with specialists in her home state, she and her family decided the best course of action for her would be to end the pregnancy, and she traveled over 8 hours to access this needed medical care. Because of Minnesota state law, Sarah then had to receive information in advance of the procedure for state-mandated counseling, causing her further delay, further heartbreak, and further burden. Forcing a woman to listen to state-mandated counseling or requiring her to wait for procedure assumes that women are not capable of informed decision-making. This should anger everyone. Beyond the distrust in women by reducing healthcare decisions to a series of mandates, lawmakers intrude into the relationship that I have with my patients. These mandates send a message that despite the time my colleagues and I have spent studying the medical literature, refining our clinical and surgical skills, and developing relationships with our patients, that we are not to be trusted to provide the best care for women and their families. These laws mandate that as a licensed, trained physician, I must lie to my patients. Not alternative facts, lie. When those patients come to me in the most vulnerable of settings and circumstances, entrusting me to provide them with medically accurate information. Politicians have no business getting between me and my patients in my exam room. We, as physicians, must have the ability to freely speak with our patients, provide them with medically accurate information based on the best available science, information relevant to each patient's personal health, and to advise them on the best course of care without fear of penalty. No woman should have to endure undue state interference with her decision to end a pregnancy. But that is already what happens in Minnesota. And it's time lawmakers pass these bills that get politicians out of my exam room and honor a woman's ability to make complex medical decisions. Thank you.
Thank you. Good morning. I'm Senator Sandra Pappas. I'm one of the Senate authors of the contraception bill, and I just have a brief statement I want to make. The reality is that consistent use of contraception reduces unwanted pregnancies and reduces abortion. It should be a bipartisan agreement to reduce the numbers of abortion. Contraception obviously does that, and we have the data to show it. But women need easy, affordable access with 12-month coverage and no cost sharing, no deductibles, no co-payments. This bill will guarantee reliable, affordable access to birth control. Thank you.
Thank you, and we'll take any questions.
Just for any of the legislators up there, just how much of an uphill battle do you anticipate with the Republican-led legislature?
We have been working on this legislation, parts of this legislation now for a number of years, and I think women now stand to lose or go backwards with the election of so many Republicans across the state of Minnesota and in the Congress. I also think they picked the wrong fight. We will work very hard to protect the gains that we have in place and to advance more progress for women's health care.
I just wanted to add that the march on Saturday really shows that women are not going to sit back and see a rollback in their rights that we've had for many, many, many years, at least since the 1970s, and have been fighting for many years before that with Margaret Sanger and some of the early pioneers for women's access to birth control. And so women have taken this for granted, and not anymore. We're going to fight for it to keep it.
And I agree that it's going to be an uphill battle, but there's no doubt that the people of Minnesota support freedom of access to health care. The laws that I am attempting to repeal in the Physician Integrity Act have been on the books since 2003, but they're so onerous that Governor Pawlenty, who signed the bill, his own Department of Health wasn't even able to carry out the dictates for them in the bill. And so I think that it is common sense to get laws that we can't enforce off the books, laws that no longer are needed because the science has come out and said that abortion doesn't cause breast cancer, it doesn't cause depression, it doesn't cause infertility. And so it's time. And like I said, like Representative Murphy said, there's a lot in here that should be bipartisan. There's a lot in here that should be bipartisan. We don't need the government interfering in healthcare. We want to empower physicians and patients, and we hear that a lot on both sides of the aisle. So stand up and do what's right. The other thing I think is, I think a lot of us share the goal of wanting to reduce unintended pregnancy, and so I think that it should be bipartisan, that we use science to achieve that goal because it works.
Well, I've only been a senator for 2 weeks, so I'll be
Not here for much longer.
I'll be learning the process. But my impression is that when we take away a mandate that physicians have to say certain things within the privacy of the exam room, that sounds to me like a small government initiative. And sounds like something that my Republican colleagues would want to champion. And that's the messaging I'll take forward.
Reproductive health was a talking point during the national election that we just passed. Are you concerned that new federal laws could potentially affect anything here or just change the general climate throughout the country regarding reproductive health issues?
Yes, I am concerned. I am concerned especially at the federal level and the quick action that the Republicans are choosing to take up with repealing but not replacing the Affordable Care Act. There are a lot of protections for women and women's health care in the Affordable Care Act, and they're hell-bent on election to repeal it without a replacement, and that's going to leave a lot of women stranded.
Somewhat connect, oh, I'm sorry.
I was going to just follow up on that, and is to say that I am concerned, and one of the ways that women's rights are going to be attacked is by states passing laws that are have historically been unconstitutional and making women litigate their rights again. We saw it in the last legislative session with the attempt to pass trap laws in the legislature, with the attempt to pass a law that public funds can't be used for reproductive health and abortion in Minnesota. Our state constitution, or our state Supreme Court has said that's unconstitutional, and yet the Republican legislature was trying to pass laws that have been declared unconstitutional to make women litigate their rights yet again. And that is a tough uphill slog, but I will tell you, and what we saw on Saturday is that women will fight. And we will litigate it if we have to, but it makes a lot more sense if we give patients and physicians what they need, and we get government out of this relationship between patients and their doctors.
I was just going to say, I'm seeing some reports here online that the president just this morning signed an executive order to block foreign aid or federal funding for international non-governmental organizations that provide or promote abortion. So I just wanted to get your thoughts on that. That's just what I'm seeing right now as this is happening.
That history of providing international support for family planning, reproductive health, abortion rights dates back to the Kennedy administration, the Nixon administration. There's a long history of our government understanding that women having autonomy over their reproductive choices, about women being safe in their relationships with their physicians, in their relationships with their intimate partners, go a long way to helping turn the tide on economic challenges that women and their families face around the world. And if we can help women and their families plan for their families, plan for their economic future, plan for their education, our world is healthier. And there's, again, look to the science. It supports it. And so the fact that our president is already attacking reproductive rights around the globe and is already putting women around women's economic futures, women's educational futures, the economic future of their children, putting that at risk should frighten us all. And again, as we said, women have stood up and said that we won't take it, and will continue to stand up. And women around the globe stood up this weekend. So
I think, we are not alone in this. He will have many opportunities with his gold-plated pen to try and take us backwards. And we're going to have to continue to fight for our reproductive rights and our civil rights and our voting rights and our worker rights. We are going to fight that fight together, and you saw the strength of that on Saturday. We are not alone in this fight, but it's real. And I think anyone who thinks that we're going to pass through these 4 years without seeing dark days in front of us are not understanding the politics of what Americans put into office in Washington, D.C.
Just a brief story. I was in Ethiopia in 1910 on a reproductive health care tour, a country of 80 million people. And there, under their health minister at the time, families, women and their husbands, would decide together that they wanted to limit the size of their families. And what it meant for them is that they didn't have to worry about how they were going to feed their children. They didn't have to worry about their small plot of land couldn't divide enough for their future children to be productive, and that they could send their girls to school. So being able to limit the size of their family meant a future for them. And it's really important that the U.S. not get in the way of other countries wanting to seek out their future. And these are international aid organizations. We're not even sending federal aid for contraceptive services. And I'm not even talking about abortion. I'm just talking about contraception, so people can decide how big a family they want to have and be able to afford it.
Senator Schoen, I'll just say one of the challenges that we have, if you want to look at the current makeup of the Senate, we came in, Senator Klein and I did, with approximately 1/3 of the total Senate being replaced. One woman came into that class with us out of 21. Isn't that the number that came in? But first and foremost, this is a woman's issue, but it's a family issue. Senator Klein and I are both dads of young daughters. And we're going to make sure we also represent people like Riley. And they're going to make sure that they know that there's more men that are concerned about this too, because we don't treat our family members and our constituents like this. That is the number one issue. Is that the battle? The battle is we have a man making these fell swoop decisions without any consideration for the people that brought us to this planet.
Thank you.
Thank you.